A healthy or normal tongue is pink and covered with small bumps known as papillae. The shade of pink can vary provided it's not red, and the bumps should cover a good majority of the upper surface. These bumps are also on the underside of a tongue, but may be less easy to spot. Fissured tongue is a harmless condition, usually with no associated symptoms. No treatment is necessary except to encourage good oral hygiene, including brushing the top surface of the tongue to remove any food debris from the fissures. Oral thrush is a condition where a fungus Candida albicans grows on the tongue. It's a fairly easy condition to spot because there's usually large white patches that look furry. Oral lichen planus is a chronic inflammatory condition that affects the mucous membranes in your mouth. It can appear as white or red lacy patches, swollen tissue, or open sores. You might also experience discomfort such as burning. Leukoplakia are thick, white patches on your tongue, and sometimes the inside of your mouth. They can appear on the top or underside, and vary in size and intensity. They are thought to be caused by tobacco or alcohol, but can also be early signs of cancer. When someone is dehydrated, the tongue appears dry and typically has a white or white to yellowish coating. In some cases, the tongue can appear patchy or splotchy. If your tongue commonly sticks to the roof of your mouth, you are dehydrated. A red tongue can mean a variety of things, one of which is a lack of vitamin B deficiencies, particularly folic acid and B9 and cobalamin B12. Scarlet fever is a bacterial illness that can develop in people with strep throat. It's most common in children from 5 to 15 and is a serious condition that requires medical treatment. It often shows as red or bright pink on the tongue, but can also be a regular pink. Bumps also appear on teeth. As with scarlet fever, Kawasaki disease shows as red or bright pink, with bumps on the tongue that can make it look like a strawberry. This isn't serious, but you should talk to a doctor because there's risk of heart issues if left untreated. A yellow tongue can be caused by a variety of issues, including lifestyle habits like smoking, certain vitamins, psoriasis, and jaundice. This is usually nothing to worry about, but again, speak to your doctor if you're concerned. Smooth tongue, a condition in which the normal rough surface papillae of the tongue shrinks or disappears, making the tongue look bald or shiny and thin. Without this rough surface, the tongue may be tender and sensitive to spicy foods. Research continues into its causes. The curious raised bumps of the tongue rash, known as papillae, can come and go from the tongue, leaving behind the smooth red patches that give this condition its name. Often, the patches heal in one area of the tongue and then move to another part. According to the NIH, macroglossia is the abnormal enlargement of the tongue in proportion to other structures in the mouth. It usually occurs secondary to an underlying disorder that may be present from birth, congenital or acquired. In addition to an enlarged tongue, it is common to see indentations around the tongue perimeter from the constant pressure against the teeth.